A 68-year-old man is evaluated in the hospital due to a pleural effusion. He has a history of base of tongue squamous cell carcinoma with involvement of multiple left anterior cervical lymph nodes. 2 days ago, the patient underwent surgery to remove the tumor and the anterior cervical lymph nodes. Today, he has increasing shortness of breath, and chest X-ray reveals a large left pleural effusion. The question is, which of the following was most likely injured during this patient's surgical procedure? Your options are A. Esophagus, B. Innominate artery, C. Lung parenchyma, D. Phrenic nerve, E. Thoracic duct, F. Trachea. If you know the answer, click the like button, and if you don't know the answer, keep watching before you fail. The correct answer is E, which is thoracic duct. This patient with a pleural effusion 2 days after cervical lymph node removal most likely has a chylothorax due to intraoperative injury of the thoracic duct. The thoracic duct is the largest lymphatic vessel. It originates at about the level of T12 in the abdomen, where the lumbar and intestinal lymph trunks converge. It travels superiorly through the mediastinum posterior to the esophagus and drains into the junction between the left subclavian and jugular veins in the lower neck. It is most commonly injured during thoracic procedures, such as esophagectomy, but can be injured in neck procedures as well, example, cervical lymph node removal. Injury can result in leakage of lymph into either the neck or the thorax because a transected duct may retract into the chest. The thoracic duct collects lymph from most of the body, including the abdominal viscera, the viscera of the left hemithorax, all tissue inferior to the umbilicus, and all left-sided tissues superior to the umbilicus. The right head, arm, and thorax drain into the much smaller right lymphatic duct. Do you even know your mistake now? If you are still confused, let me show you why the other choices are not correct. Choices A and F cannot be the answer because the trachea and esophagus are deeper structures in the central neck that are covered by strap muscles. They are unlikely to be injured during removal of cervical lymph nodes in the lateral neck. In addition, although injury to the esophagus or trachea can cause pleural effusion, such injury is typically accompanied by air accumulation like crepitus in the neck and/or pneumomediastinum. Choice B cannot be the answer because the innominate artery is the first branch of the aortic arch, and it crosses the mid-trachea from left to right in the thorax. It does not travel through the left neck. In addition, injury to the innominate artery would cause massive blood loss, resulting in immediate hemodynamic instability. Choice C. The apex of the lung can project into the neck and be injured in some neck surgical procedures. However, injury would cause an acute pneumothorax rather than a slowly accumulating pleural effusion. Choice D cannot be the answer because the phrenic nerve, which originates from C3-C5 and travels with the internal jugular vein, can be injured during neck procedures. However, such an injury would present with elevation of the hemodiaphragm. If your answer was correct, you have our permission to subscribe and continue to the next case.